I've been asked, is diarrhea common after removing the gallbladder, and can a person have irritable bowel syndrome after they have their gallbladder removed? They're basically two distinctly separate entities. Once the gallbladder is removed, the anatomy within the body is changed, and you no longer have the ability to have a sac that systematically secretes the bile for your body to digest and absorb fat. So when that occurs, there can be an overwhelming burden of bile being produced by the liver whenever someone ingests fat. And that doesn't get reabsorbed by the small intestine, gets into the colon. The colon, due to the alkalinity of the stool, can have increased mucus production by the colonocytes, and the frequency and the looseness of the stool can increase. The best way to deal with that is to decrease your fats in your diet. A lot of people get better that after about 6 months. Usually this is just a transient thing and an intolerance for about 6 months, and patients usually get better. But for some people it becomes chronic. When it becomes chronic and lasts for a longer duration, then you certainly could be suffering from irritable bowel with diarrhea. And there are certain treatments that are best suited for that as well. So my advice is to look at your diet. If you've had your gallbladder taken out recently, cut back on your fat for at least 6 months, and then systematically introduce foods that may have fat in them to see if you're able to tolerate them. And there may be always certain foods that you'll be relatively intolerant for since you got your gallbladder removed. There are medications that can be prescribed that can insipitate the stool or tighten the stool up to decrease the symptomatology. If you have overlying irritable bowel, there are also other medications and dietary methods that we can utilize that can improve that quality of life. Hopefully this has been helpful. This is Dr. Brian Gillis giving you his perspective.